Hi, I'm going to talk about epidemiology. Here are the topics. What is epidemiology? Etymologically, the word epidemiology comes from Greek and means treatise on the people. Epi, upon, demos, people, logos, treatise. We could define epidemiology as the science that studies the distribution and determinants of the health disease phenomenon in human populations. Key terms in the field: incidence, the number of new cases of a disease or disorder in a population over a period of time. Here we have the formula of incidence, that is, new cases divided by population at risk. Prevalence, the number of existing cases of a disease in a population at a given time. The formula is prevalence prevalence is all cases divided by population at risk. Cost of illness. Many reports use expenditures on medical care. This is actual money spent as the cost of illness, but there are also other factors like educational, work-related, and support services cost. Burden of disease, the total significance of disease for society, beyond the immediate cost of treatment. DALI, disability adjusted life year, a summary measure of the health of a population. One DALI is 1 year and measures the gap between the current health and the ideal life expectancy of a population. Morbidity and mortality. Morbidity and mortality are two key measures used in epidemiological surveillance to describe how a health event progresses and how severe its impact becomes. These measures help identify disease risk factors and allow meaningful comparisons across different populations. Although related, morbidity and mortality are distinct concepts. Morbidity refers to the state of being symptomatic or unhealthy due to a disease or condition and is typically expressed through prevalence or incidence. The formula is of morbidity is number of cases of disease, injury, disability divided by population. Mortality relates to the number of deaths caused by the health event under investigation. It can be communicated as a rate or as an absolute number. Mortality is usually represented as a rate per 1,000 individuals, also called the death rate. The formula for mortality is number of deaths in a year divided by total mid-year population multiplied by 1,000. Correlation and causation. Correlation is a statistical measure expressed as a number that describes the size and direction of a relationship between two or more variables. A correlation between variables does not necessarily imply causation. Causation indicates that one event is the result of the occurrence of the other event. This is, there is a causal relationship between the two events. This is also referred to as cause and effect. Epidemic, pandemic, and endemic. Epidemic. The Centers for Disease Control and Prevention (CDC) describes an epidemic as an unexpected increase in the number of disease cases in a specific geographical area. Examples: yellow fever, measles, and polio. An epidemic disease doesn't necessarily have to be contagious. For example, rapid increase in obesity rates. Epidemics can refer to a disease or other specific health-related behavior, for example, smoking, with rates that are clearly above the expected occurrence in a community or region. Pandemic. The World Health Organization (WHO) declares a pandemic when a disease's growth is exponential. This means the growth rate skyrockets and each day cases grow more than the day prior. In being declared a pandemic, the virus has nothing to do with virology, population immunity, or disease severity. It means a virus covers a wide area, affecting several countries and populations. Endemic. A disease outbreak is endemic when it is consistently present but limited to a particular region. This makes the disease spread and rates predictable. Malaria, for example, is considered endemic in certain countries and regions. Epidemiology in a post-COVID-19 world. The COVID-19 pandemic upended global mortality and morbidity. During the COVID-19 pandemic, disability adjusted life years dailies due to infectious, maternal, neonatal, and nutritional diseases all increased, but has since returned to pre-pandemic levels. Other challenges are emerging faster than expected. Non-communicable disease rates are surging, especially in LMECs, low-income and middle-income countries, particularly in Africa. The speed and scale of this epidemiological transition from infectious diseases to non-communicable diseases is cause for urgent concern. The current isolationist-driven health landscape is incompatible with a successful global health agenda. As you can see, there is a news title about the United States leaving the World Health Organization.